let's talk about something I almost never talk about, which is breast reduction surgery. This is actually one of the highest impact surgeries in my patient's life. It's one of the most well-received surgeries in all plastic surgery with the highest rating of approval from patients, meaning most patients that get it done, like 97%, are extremely satisfied with their results. Why is this the case? Because it's a functional surgery. It takes the heaviness off your back and your neck, but it also gives you a better shaped body and better shaped kind of upper structure of the torso. So you can put on clothing, you can wear dresses, you can also be more active. Now, what is it that makes a breast reduction good? Because the reality is we've all seen a lot of breast reductions where I just feel like they're not as good of a result. They look low, bottom heavy. They don't look as pretty as a natural breast should look. The bottom line is every patient wants the same thing with regards to all breast surgeries, whether it's augmentation, lift, reduction, secondary surgery. They want a breast that looks like this with a nipple that projects the most projecting point right here. They want a perky breast shape. They also want upper pole fullness and central cleavage. How do you get that when you're doing a breast reduction? It's simple. You leave the tissue above and centrally in the breast and you remove the low, heavy stuff that's in the bottom. But 90% of plastic surgeons leave the tissue in the bottom and take it away from the top because that's what they're taught in residency. It's called an inferior pedicle because the supply, the pedicle, comes from below. But it's actually an inferior surgery. It's not a good one. We like a superior pedicle or a central pedicle. I want to maintain the blood supply from above and the support from the chest wall. You get better sensation, better blood supply, and better upper pole fullness. But it's harder to do because technically the dissection is a little more difficult. It's scary in terms of blood supply. If they don't understand the breast anatomy, they can run into problems. Bottom line is if you preserve the fullness up top and in the middle, you get a perky breast that looks almost like a breast augmentation on the table. If you save everything below, you get a low, heavy breast and not a good result. It's important to understand these concepts because breast reduction surgery is something that people want and like because of the functional benefits, but it should also look pretty, perky, and beautiful.